Good evening, ladies and gentlemen. I remember humble self Lucky, Dr. Drugs. And today I have the pleasure of presenting a very amazing topic. And the topic I'm presenting today is none other than something that concerns everybody on earth as far as you have a heart beating in your chest. And it's heart attack as well as its colleague, angina pectoris or chest pain. Oftentimes, we hear people complain about this kind of pain that's like tightness or discomfort that radiates to the neck, left arm, jaw, and all that. And we wonder why. So today we're going to throw more light into that. And I promise us that we're going to try to do something that will make everyone's mind be more open towards this challenge that affects a lot of people. And guess what? It can be quite silent. That's why people find it very difficult to handle. Sometimes some people wake up in the morning and all they know is that their heart is beating, wear their shoes after having their shower, brushing their teeth, eating breakfast, and they're off. Not checking that little pain that they're feeling in their chest upon exertion and all that. We'll talk about that shortly. I remember humble self Lucky, Dr. Drugs, and our table of contents goes thus. You see, we can't talk about this topic today without talking about the human heart briefly. Then I'll tell us about the greatest assassins. I always like talking about that. Then lifestyle diseases, atherosclerosis. What is it? We've been hearing about these things. You don't have to be a scientist or a medical guru to know these things. They will be explained in very simple form for us to understand. Now, how does this atherosclerosis happen? Just know that atherosclerosis simply means cholesterol aggregate or cholesterol blockage in quotes. Then we'll talk about heart attack or myocardial infarction. We'll talk about the types, talk about signs and symptoms. Then we'll talk about chest pain or angina pectoris. There's something that is going to make us, smile a bit when we talk about that aspect. Not funny though, but it's actually true. Then we'll talk about types of angina pectoris, the relationship between angina pectoris and heart attack. What's their relationship? Then we'll talk about the causes and risk factors, diagnosis, complications. How often does it happen around us? Prevention of heart attack, how is it prevented? Management attributed to heart attack, challenges in the management of heart attack, chemical intervention, and so on and so forth. So the human heart is the muscular organ that basically helps us to pump blood through our blood vessels in our body circulatory system. And of course, we know it's located in the middle and the tail is tilted a bit to the left. And the function basically is to transport the oxygenated blood, that's blood with less oxygen and more carbon dioxide from the body to the lungs, and send oxygenated blood, that's blood with more oxygen and less carbon dioxide from the lungs to the body. In fact, one is confirmed clinically dead when the heart has stopped beating and there's no breathing. So the two greatest assassins, as I often say, are not 007 or Tom Cruise in Mission Impossible and all that, but cholesterol and stress. Most of the things that kill human beings on earth today are linked to cholesterol and stress. In fact, technically, aging is linked to cholesterol and stress. One of the topics we'll be treating in future is aging and how to stop rapid aging. We'll talk about that soon. That's after I'll talk about infertility and all that. Then I want us to understand that cholesterol deposits directly and indirectly account for most cardiovascular issues and lead to ischemia. When you hear me say ischemia, just know that I mean that some cells have died as a result of blockage of blood flow to them. Because blood carries what? Oxygen and nutrients. Of course, stress leads to excessive accumulation of free radicals or reactive oxidative species that damage DNA. And you know that DNA is the MDCO, head of board members, managing director of everything that has to do with you. In fact, your DNA is what made you you. And in fact, you are just like a biological device transferring your information in your DNA to your children and so on and so forth. So that shows you how important it is and how stress affects it can really affect us. So lifestyle diseases, the name already is an expo. It just means that diseases that are linked to one's lifestyle. Believe it or not, these lifestyle diseases are responsible for most deaths on earth because they affect vital organs like the heart, liver, and in fact the body in general, and can block blood vessels or lead to blockage of blood vessels. And you know, without blood, there is no life. So examples of such lifestyle that we indulge in include lack of physical activity. Some people will never exercise to save their life. Poor dieting, alcoholism, smoking, substance abuse, lack of rest, and other lifestyle choices that affect our health badly. In fact, any patient of mine must exercise. That's my rule. You can verify from people that have handled their cases, and they always come back to tell me that they are getting better. We'll talk about that shortly. We'll know why shortly. So a few examples of lifestyle diseases include heart attack, cardiovascular diseases like hypertension, atherosclerosis, obesity, which is the mother of lifestyle diseases because it is connected to almost all the lifestyle diseases you can think of. We'll talk about that shortly, including arthritis. You can imagine. Type 2 diabetes is a disease of diseases, ischemic stroke or stroke, respiratory ailments, fatty liver disease, high blood cholesterol, and so on. But let us bear in mind that prevention of these lifestyle diseases entails avoiding the avoidable risk factors. Lifestyle diseases often move together. It's more like all for one and one for all, like the Three Musketeers by Alexandre Dumas. And you see that lifestyle diseases are mostly reversible. But guess what? The earlier, the better. Chase your black goat in the afternoon, because when it gets dark, you may not find it. Now, coronary artery disease. These are often as a result of atherosclerotic plaques. And you can see, I mentioned earlier that cholesterol blockage is responsible for a lot of these heart diseases. And of course, cholesterol blockage is responsible for atherosclerotic plaques. In fact, we can use their names interchangeably, you know. And guess what? When this cholesterol blockage obstructs blood flow to heart muscles, we will see what happens shortly. Look at the picture here. You see that already happening, and you can see the blood that is supposed to pass through this area has been obstructed and is already finding its way to another place entirely. So the cells on the other side will definitely begin to die. Now, atherosclerosis or plaque. Atherosclerosis is a condition that occurs when fatty deposits like cholesterol build up in the walls of arteries, narrowing them and reducing blood flow. This buildup is called, you see, plaque. Now, the causes include high blood cholesterol, because you can't get cholesterol aggregates without cholesterol. High blood pressure simply damages the inner lining of the arteries and gives these cholesterol anchor points that they can now attach to and begin to build up until they block that area. Look at the picture on the right side, bottom right side of the screen here. You can see that happening on one branch of that blood vessel. And look at how this heart is full of cholesterol deposits, as you can see there. Smoking, of course, can cause damage to the arteries. Diabetes is a disease of diseases, and guess what? It directly increases bad cholesterol. In fact, there's a very strong, that's the link between type 2 diabetes and hypertension. One of the links, actually, because when the blood vessels are blocked, the heart will need to pump with a higher pressure, and that pumping of with a higher pressure is equal to what? Hypertension, when it becomes sustained and above normal. Then obesity is the mother of lifestyle diseases because it can increase the risk of high blood pressure, it can increase the risk of high blood cholesterol, it can increase the risk of type 2 diabetes. We talked about these in various topics on Dr. Drugs. You can go to Dr. Drugs on YouTube and watch management of hypertension, management of high blood cholesterol, management of type 2 diabetes, ischemic stroke, and so on and so forth. Now, a family history, of course, genetic predisposition, age, of course, is another issue, then inflammation. Bear in mind that almost all the processes involved in heart attack are strongly linked to inflammation. That's why I keep appealing to my patients to mind the way they consume refined carbohydrates like sugar found in sodas and all that, because they are quite inflammatory, as well as stress. Stress will lead to a cascade of reactions that can lead to inflammation and can provoke a lot of issues. So how does this atherosclerosis happen? Now, I want to break this down in such a way that we can easily understand. You see, it starts with the inner lining of the blood vessels. This is a blood vessel. You can see the inner line is supposed to be smooth and slippery so that these blood corpuscles can carry oxygen and food to and fro to the to the flesh and other parts of the body, and from the lungs, or to the lungs and from the flesh, depending on whether you're talking about an artery or a vein. But we're talking about an artery now, so it's supposed to help us carry blood vessel, carry food or nutrients and oxygen to the flesh. But you can see what cholesterol is doing here. How does it start? You see, it begins by coming as a visitor, and then the accumulation of bad cholesterol or low density lipoprotein cholesterol within the artery starts quietly. And before you know what's happening, white blood cells begin to complain, hey, why are you accumulating in this area? And they try to remove those things. But as they do so, they find themselves being stuck in the problem as well, and they form what is called foam cells. And you can see that these macrophages engulf large amounts of oxidized bad cholesterol. Remember that this oxidized bad cholesterol, the oxidative process can be worsened by what? Stress. Reactive oxidative species and free radicals that are associated with stress too. So it's that lack of sleep, always working 24 hours, no break, and all that can actually lead to what? These inflammatory processes and these kind of issues, and can make it, faster. These foam cells, in quotes, before you know it, they have a fibrous cap formation. Now, where the problem lands is this. When this fibrous cap, as a result of the smooth muscles in these blood vessels producing collagen fibers to cover it, the problem is that fibrous cap can break open, and it will just seem as if, just like someone having a cut on the skin, then clot begins to form. But guess what? As this clot forms on that cap, it begins to get bigger until it blocks the blood vessel completely, and that can lead to what? A heart attack. That's just a very lay summary of what happens here. So let's also bear in mind, as aforementioned, that inflammation plays a crucial role in all stages of plaque development. So let's bear this in mind, because when we're talking about the management, you will see that we'll definitely mention things that are going to help to mitigate inflammation in the system. Now, a plaque can become unstable if the fibrous cap thins or ruptures, leading to blood clot formation and potential cardiovascular complications like heart attack or stroke, as aforementioned. Ladies and gentlemen, we have landed. This is heart attack, and a heart attack is simply heart cell death due to what? Poor blood flow, period. And a heart attack occurs when the blood flow to the heart is blocked, causing damage to the heart cell tissue or muscles. Now, what are the different types we have? These are just different grammars to explain the different degrees and ways this problem happens. We have what is called an ST segment elevation myocardial infarction. It is very severe and it's the most severe type, causing significant damage to the heart muscles due to a long interruption of blood supply. But it's also followed by non-ST segment elevation myocardial infarction. This is less severe, but still requires prompt treatment. It is due to a blockage in the coronary artery that causes some loss of blood supply. That's partial loss of blood supply and damage to the heart. Then unstable angina is a warning of symptoms for a potential heart attack. We'll talk about that shortly. It indicates an imminent heart muscle damage as a result of restricted flow of blood to the heart muscles. Then we also have the worst of all, a silent heart attack. That's the type that they will say, oh my God, they shot arrow to the person. Oh my God, the uncle is struggling for land with him and went to do some juju, and then he now did this and did that, not knowing the person was having heart attack silently. And that's the worst of them all, and so on and so forth. Now, the signs and symptoms. If you look at this man at the bottom right of our screen here, we don't need to ask much questions about signs and symptoms. The way he's holding his heart in his hand and shouting help, or like someone in pain, you have an idea of what the signs and symptoms can be like. Chest pain or discomfort, which is also known as angina pectoris, talk about that shortly. Of course, pain or discomfort in the arms, back, neck, jaw, or stomach. Sometimes people complain of stomach discomfort. They think it is even peptic ulcer disease, and only to find out that they are having signs of what? Heart attack. Remember that heart attack does not mean cardiac arrest. Heart attack means it's myocardial infarction, but can lead to cardiac arrest or heart failure. You understand? So when you hear heart attack, you think that the person is already dead. No, it's just the way it sounds. In fact, a stroke is called a brain attack. And you know that many patients that have had strokes are not, doesn't mean a person that has stroke is already dead. You understand? So you can see. And it's the same process that the cholesterol blocks the blood vessels in the heart, that it also blocks the blood vessels in the brain and can lead to what? An ischemic stroke. Shortness of breath is also a very serious symptom. Cold sweat, lightheadedness, tiredness or fatigue, rapid or irregular heartbeat. Some people's hearts beat like a DJ that forgot his post, or maybe he was DJing and his babe passed and he just went to say hi to her and the machine is just beating off beat. And that's how it happens, because we have what are called the pacemaker cells or SA node that regulate heartbeat. And when they are also having this cholesterol blockage, blocking supply of nutrients and oxygen to them, what happens? They begin to miss beat, or the heart itself begins to have what is called cardiac arrhythmia or irregular heartbeat. That's just so you can see that is also related, because those nerve fibers and those cells are very important. It's very important that they also have very good supply of blood as well. Nausea and vomiting, anxiety or panic, because your brain is waiting that something is wrong, something is going on, and then you see yourself panicking on unnecessary, coughing or wheezing, seizures, because the brain is now beginning to have less blood supply. Then, of course, swelling or edema, because the blood is pumping down the leg, but to come up again is a problem. The heart is having issues. So the pumping machine of the blood in the heart is having problems. So it can pump downwards, but to pull the blood back up was a problem. And then you start, some fluid in the blood begins to seep into the tissue in the feet, especially. And then you see, of course, sudden confusion is not left out, so on and so forth. Now, angina pectoris. If you look at this man, you know that he's just coming back from work. He's an MD, CEO, an executive in a very big company, but he has not been taking care of himself. And we'll see the kind of activities that he has been undergoing recently that has led to this problem. But meanwhile, angina pectoris is simply pain in the chest that radiates from the heart as a result of myocardial infarction or heart cell death. See? So it's more like a symptom, you know, and this is due to poor blood flow as cells of the heart die due to lack of oxygen. They cry out in pain, and this pain is referred to the chest and sometimes to the shoulders, the arm, the neck, the jaw. Remember, the left arm is mostly affected as well, and may also lead to upper abdominal discomfort that some people mistakenly think is peptic ulcer disease. And that's why it's very important you go and meet a trained health practitioner when one has symptoms like this. Angina pectoris is a medical condition that is a symptom of coronary artery disease, when the arteries that supply the heart are having issues. So, angina pectoris is a symptom or sign of impending heart damage. It's just nature's alarm telling one that there is impending danger, because the heart is the most important organ of the body, as it is the organ that determines whether one is clinically dead or clinically alive. This damage to coronary artery and myocardial infarction can actually lead to the pain, that sensation one is feeling in the chest, and that discomfort for angina pectoris. That is that. So these are the different types of angina pectoris. There's something that sounds a bit funny here, but it's worthy of note. Now, some people complain that this chest pain only happens when they exert themselves, when they do some physical activity, or they have some kind of tension or something that makes the heart beat fast, then they feel that tightness in the chest or that discomfort. That is called a stable angina. But we also have an unstable angina. That unstable angina can occur even when the person is relaxing and sipping some pina colada and you're having pain in the chest and not doing any job or anything. That means that person is having very serious, imminent danger, because the person is not exerting himself and the heart muscles are complaining. They are complaining, they are crying out in pain. That means there's a problem, and it's most likely that person is about to have a heart attack, if not attended to. Then we have vasospastic angina. This often occurs due to deep emotional stress, and it's also called Takotsubo syndrome. And of course, we know our better halves are very emotional, and that's why I see when a girl or a lady that was expected to get married to a guy and they've been dating for 200 years, and all of a sudden she comes home one day and it's just like all this telenovela, and she finds the guy with another babe. Have you ever seen the lady hold her head or her ear or her nose? No, they hold their chest because they are having takosubo. It's a form of heart attack. So it's also known as heartbreak syndrome. So guys, please, let's take it easy with our ladies' heart so they don't have takosubo. Of course, it's characterized by spasms of blood vessels of the heart. That's on that, and so on and so forth. Now, what is the relationship between heart attack and angina pectoris? We've already discussed that. The relationship is that heart attack or myocardial infarction and angina pectoris are closely related conditions that affect the heart's blood flow. Angina pectoris is a symptom of coronary artery disease where the heart muscle does not receive enough oxygen-rich blood. They cry out in pain, leading to chest pain or discomfort. They're saying that they are dying. And when they are dying, that means the patient is already having what? Myocardial infarction or heart attack. So angina pectoris can be a warning sign for potential heart attack. Obviously, you see the man sitting down here experiencing severe angina pectoris. We don't need to ask this man, Oga or Sir, how are you feeling? Because he's about to have a heart attack, most likely as a result of unstable angina. So what are the causes and risk factors? Please, let's pay close attention. Let's pay close attention to this. Coronary artery disease. You see, plaque or cholesterol aggregate buildup in the coronary arteries, the arteries that supply the heart, can also lead to this because they restrict blood flow to the heart muscles. Blood clot is another issue that can cause it. High blood pressure, as aforementioned, high blood cholesterol, excessive bad cholesterol can also contribute to plaque buildup. Smoking damages coronary arteries, giving the cholesterol, the bad cholesterol, anchor points in the blood vessels where they can grow and block the blood vessels eventually, or form the kind of clot that will now build and finally block the blood vessels. Diabetes, as we all know, is a disease of diseases. It not only can lead to high blood pressure, but can lead to increase in bad cholesterol levels in the blood, and of course, can cause that. Obesity is the mother of lifestyle diseases and can lead to diabetes, high blood cholesterol, hypertension, and so on and so forth. And all these things can eventually lead to what? Heart attack. Let's not even forget that sugar, which is inflammatory, is often excess in the bloodstream of those that have type 2 diabetes. If you check a lot of patients that have heart attack, you'll find out that they have high blood cholesterol, hypertension, and guess who again? Diabetes. And many of them also have who? The mother of all lifestyle diseases, obesity. And you see why I always tell my patients you must exercise to avoid all these kind of problems. Now, a family history is not left out because of genetic predisposition. But a lot of people claim that because they have everybody in their family fat, or everybody in their family having high blood cholesterol, that means they must have. Genetic predisposition is not genetic sentence. It just means that one has the tendency to, because we have both genetic factors and we have environmental factors to make these things come to fruition, or to make these things happen, rather. Then we have age, we have stress, talked about that. Remember that chronic stress can increase blood pressure and heart rate, and you know what hypertension does. Of course, we have lack of exercise. Sedentary lifestyle contributes to heart attack risk. Unhealthy diet is self-explanatory because when you eat too much, you can become fat. And of course, one can have bad cholesterol roaming around because the body finds ways to dump this excess energy or store it. And guess what? Can store it as fatty substances, as the ones we find in the blood, or we find on the stomach area or parts that can make one what? Fat and obese. Certain medications are not left out. Illegal drug use, alcohol consumption. Remember that excessive drinking damages heart tissue and increases heart attack risk by increasing bad cholesterol directly. It directly increases bad cholesterol, and that's the reason why it causes that problem. Of course, anemia and low blood volume. In fact, when there is no blood to even pump to the heart itself, of course, the heart can automatically have a heart attack. Look at this picture here. You can see stress. You can see bad cholesterol. You can see high blood pressure. And guess who again? Type 2 diabetes, especially, or diabetes. And you can see that it's self-explanatory. The reason why I put this here is because I want us to understand that we are what we consume. That is it. So there's nothing like that. We don't know how it happened, or we don't know where it came from, or is somebody from the village. You've forgotten when you were sleeping in McDonald's. You refuse to go home. You eat from morning till night. You eat all sorts of things. You eat 12 midnight. 4 a.m., you're cooking noodles. You're frying 4 eggs. You're eating a whole loaf of bread. You use bread to brush your teeth, one whole loaf. You use the jug of tea to rinse your mouth full of sugar. You've forgotten? Now, when one has problems like this, they remember. So this is what I call Dr. Drug's donut analogy. So let's take a donut as an example. You see, a donut has a high amount of refined sugar. It contains a high amount of cholesterol-related substances. You all know, refined carbohydrates, water, and this and that, put in the oven and all that. It doesn't exercise. The baker does everything, the kneading and all that. It has a sedentary lifestyle. It sits in a show glass until you want to buy it. And it has its best friend are Coke, Fanta, malt, and other sugary foods. So show me your friends, and I'll show you who you are. It's often enjoyed on dates with soda in fast foods, right? Now let's look at the analogy. Now the above are the characteristics of a lot of people who have diabetes, high blood sugar, high blood cholesterol, that can lead to ischemic stroke, fatty liver disease, and even heart attack and chest pain. People that lack exercise don't do exercise because remember how the donut sits down, does nothing, is the baker that does everything and puts it on his show glass and all that. They have sedentary lifestyle. Who has ever seen a donut jogging before? I haven't. Then, of course, they are best friends with Coke, Fanta, and malt. You know how it goes now. When you go into fast food, you buy the donut and then you buy what you use to wash it down. And oftentimes, things that have high refined sugars. Of course, one can have a future date with heart attack, most likely, just as the person even enjoying it can have a date too. Then the donut is already in a date, and that person can have a date with heart attack in future, most likely. So in short, you are what you consume. And we must learn to eat to live and not live to eat. That is just how it is. And that's the difference between us now and our ancestors. Our ancestors, they ate to live, and they definitely live longer. But in this generation now, we often live to eat. And that's a very big problem. I want to show us an example. So we'll see whether this my theory is actually correct or not. Now, this is suspect X. And look at the donut on the right and look at suspect X on the left. Now, tell me whether what I'm saying is not true. You can see his stomach is already looking like a donut. Is this not an evidence that somebody is what he consumes? You are what you consume. He loves eating donuts, and now he's looking more like a donut. So, of course, this guy is just looking like an ambassador for hypertension, or a commissioner for type 2 diabetes, or a minister for high blood cholesterol. Just look at him. So these are the kind of things we talk about. This is also the lighter notes, but of course, I understand that I know we understand what I'm saying. Now, each of these factors contributes to the development of a heart attack by damaging coronary arteries, increasing blood pressure, reducing blood flow, increasing cholesterol aggregates or plaque buildup, affecting blood vessel function, increasing heart rate and workload, and damaging heart tissue. And at the end of the day, the person's heart will pick up a picket line and be saying, help, we need help, because the problem is becoming too much. So how do we diagnose this? Of course, we need medical history. Sometimes some people find my videos online and they send a picture, they send a message to me, they say, how much? I'm like, how much for what? No health history, no medical history, no nothing. I'm like, no, that is not possible. No health practitioner will attend to anybody without health history. It is impossible. Or do I say next to impossible? So let's bear that in mind, because the questions about the symptoms, medical condition, and medications are going to be asked. Physical examination can also help us for checking pulse, blood pressure, electrocardiogram is also very important. That's ECG. Then we have blood tests, we have the troponin, we have the creatinine phosphokinase, we have myoglobulin, we have complete full blood counts, blood chemistry tests, and a lot of others. Imaging tests are also very important. Echocardiogram, because you find out that some people eventually begin to show signs that their heart is, the shape or the silhouette of their heart has changed. That's what we call a cardiomyopathy. Stress test measures how the heart functions under physical stress. Then we have other methods that we'll discuss some other time that involves catheterization and all that. Now, lipid profile very briefly. This is very important because we know that cholesterol is actually like something that provokes this problem. It's what actually starts this problem oftentimes. And that's why this lipid profile is very important. Let's take note of the correct parameters. You see, some people come with lipid profile test and they show me that when they went to the lab, they wrote maybe like 230 or 250 to be the highest. It is wrong. The maximum of total cholesterol is 200 milligrams per DL. It shouldn't be more than that. And the HDL should be more than or equal to 60 milligrams per DL, preferably. Bad cholesterol should not be up to 100 milligrams per DL. And then the triglyceride should be less than 150, and the very lowest level of protein should be less than 30 milligrams per DL. This is very important because I keep noticing some people, and that is the reason why some people have this heart attack, because when you check the ratio of the total cholesterol to the good cholesterol or high base level protein cholesterol, you find out that it becomes higher than 3.14 to 1, and that is a very big problem. Sometimes it will seem as if everything is actually within normal range, but it is not. It's not. So we need to really work on that. Now, of importance is that total cholesterol to HDL ratio should be below 3.14 to 1, as Paul mentioned. But you can imagine that one can even predict when someone can have maybe having the tendency of having type 2 diabetes by checking the ratio of the total cholesterol to triglyceride ratio. You can see how this is very important. So this lipid profile test is also known as a lipid panel of cholesterol test, measuring the different levels of lipids in the blood and also in relationship with each other. Very important. So what are the complications of heart attack? We have heart failure, irregular heartbeats, cardiac arrest, heart valve problems, cardiac rupture, aneurysms, pericarditis, myocardial infarction, myocardial rupture, that's a tear in the heart muscle, ventricular septal defect, and of course, we have a free wall rupture and so on and so forth. You can see this heart putting this heart with a hat on his head, putting his hand on his head. There's a problem. So you can see epidemiology. But whether we like it or not, a lot of people are having heart attack. But of course, most obituary posters often just have the person died after a brief illness. If you go and investigate further, you find out that about 17.9 million people die annually from this problem. And that's why it's a very big issue. Of course, we know that prevention is better than early detection. And basically, we have to avoid or quit. We have to quit smoking, not even avoid, quit smoking. Exercise regularly. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise, or a combination of both each week. Our bodies are designed to live forever initially. And when we give our bodies what they need or give it the break it needs, you find out that everything begins to go back to normal. Then we have maintain a healthy weight, avoid alcohol consumption. The limit is for people that don't have an attack yet, but those that are having the signs, please avoid completely. When we say limit, we're talking about 1 glass of wine max a day. Then we can enjoy what is called the French paradox, in which we go into what is called the normal stage. Because we have stages of alcoholic intoxication. We have the normal stage, we have the social stage, we have the pre-intoxication stage, intoxication stage, stupor stage, comatose stage, and death stage. But that first bottle takes us to what? The normal stage, where we become superhuman. That first glass, of wine takes us to that stage where we become superhuman. So let's bear this in mind. Because some people will say, hey, they say limit. But that somebody's limit can be a drum of big stout, or a drum of stout, maybe that person's own limit. While that person will just take a simple cup of, or 3 or 4 spoons of alcohol, and they're already stationed for their way home. So let's take note of that. So avoid completely if possible. Then we have manage, in fact, not even if possible, avoid completely. Now we have to manage stress. Of course, that's very, very important. Diet modifications are also very, very important, because remember, we just get the depiction that you are what you consume. Manage underlying health conditions like high blood pressure, diabetes, and high blood cholesterol. Get enough sleep. There's something called growth hormone. When we have regular sleep, you find out that the first 2 hours of that regular sleep, when you're sleeping, if you sleep by 10 p.m. every day, between 10 and 12, there's a spike of growth hormone, and that growth hormone is known to heal the body. Let us ask ourselves this question. When God wanted to create Eve, what did he do to Adam? First, he put Adam to sleep. I just got that from. So you see, that means sleep must have a very, very important role in repairing or, doing things that are good for our bodies. So that's just it. Then we have to manage underlying health conditions. I've said that. Get enough sleep. I've said that. Get regular checkups, because you cannot treat what you don't know about. And of course, take medications regularly. So how do we manage and treat this condition? You see, this typically involves a combination of medications, lifestyle, and medical procedures. And the goal of treatment is basically to open the blocked arteries to restore blood flow, reduce damage to the heart muscles. Very, very important, because those heart muscles should not get damaged, because once the scar tissue has begun to form there is problem. And then prevent future heart attacks. Of course, manage related conditions like high blood pressure, diabetes, and high blood cholesterol. So what examples of medications do we normally use? We have thrombolytics, those that dissolve clots. We have antiplatelets, those that prevent aggregation. We have the nitrites. Of course, we would have heard of sublingual nitroglycerin that helps to dilate blood vessels. We have the beta blockers that slow the heart rate down and reduce the blood pressure to reduce the strain on the heart. We have the angiotensin converting enzyme inhibitors, and we have the angiotensin receptor blockers. These help by lowering blood pressure via the renin-angiotensin aldosterone system. We have the statins. Those are the ones that are the 3-hydroxytrimethylglutaric coenzyme A reductase inhibitors. Those ones help to prevent the formation of cholesterol via the mevalonate pathway. We have the blood thinners, like those aspirin and all that we take. I think the clopidogrel also has its own mechanism of action, and so on and so forth. Then we have lifestyle changes. We mentioned quitting smoking. We've mentioned exercising regularly. We've mentioned following a heart-healthy diet. There's something called the Mediterranean diet. I think I'll show something about that shortly. Maintain a healthy weight, because if you have an increase or if you have an excess weight, you are giving your heart extra stress to supply blood to that area, to that extra body mass. When you have excess weight, you are giving your heart extra work, because it has to pump blood to that area to supply nutrients and oxygen. That's just how it is. In fact, let me give us a very coded analogy. In fact, it's not coded, but let me just give us an analogy. If you have a building and you have a small pumping machine pumping water to that, let's say 2-story building, and then God blesses you, you now build 4 buildings around it. Are you going to still be using that small pumping machine to pump to all those buildings? No. You need more pressure to supply the extra buildings that you have constructed in your compound. And what do you need? You get a bigger pumping machine. If you look at this analogy, you find out that this is also the reason why a lot of people have enlarged hearts, because the heart needs to, the pressure needs to be increased, and a bigger pumping machine is needed, and the heart begins to enlarge, and then the person goes to the ECG or echocardiogram, and the silhouette of the heart is showing cardiomegaly, or is showing what's called hypertrophy. That's the muscle of the heart are becoming thickened, and when they get thickened, they block the area in the heart that contains the blood that it pushes out to the body, and the patient begins to have a series of complications, just like a chain reaction. That's just an analogy, simple analogy. You see, so we have to limit alcohol consumption and manage stress as well. Now, let's not leave out medical or surgical procedures, as you can see here, and of course, other types of treatment and management. Now, this is a Mediterranean diet. It's what I simply call all things bright and beautiful. You see semoris here, azul. Did you notice anything like gin, benson? Did you notice anything like what's that drink? VSOP, XO? None of them is here. What we find here is what I call all things bright and beautiful. If you can eat like this every day, believe it or not, you are very far from heart attack. When you combine dieting as well as exercise, as well as natural pharmaceuticals. Talk about that shortly. So what are the challenges in the management of heart attack? Delayed diagnosis, because you cannot treat what you don't even know about. So some people don't even bother to check themselves, and when the situation is critical. Of course, we know how things happen in this part of the world. Oftentimes, people just keep working and working and working and working until their next of kin enjoys all their labor. That is just how it happens oftentimes. There's a tribe I know that is like that. Workaholics to the core, they don't joke with business and everything. But guess what? Believe it or not, you are working for your next of kin if you don't take care of yourself. It's not a bad thing though. The money will still at least help on that person. But please try to enjoy the fruit of your labor by checking yourself. Then limited access to health care. A lot of people know what's going on. There's a country, I don't want to mention the name of the country, that is known to be one of the highest exporters of health practitioners. Of course, that's a problem. And of course, the healthcare system in that country, I didn't mention the country, is no healthcare system, in short. Only the rich can take care of themselves in that country. High cost of treatment, lack of awareness. Imagine someone having chest pain, a person like, my name is after me. And the person begins to do all sorts of things, maybe go to the river and start dancing around with one calabash on his head, not knowing that he's about to have a heart attack. What is going to happen to that person? Then the person dies. They say, hey, he said it to, after him, he just got promoted at work, forgetting that this person is only sitting there in the office from morning till night, January to December, eating there, no exercise, no, sun does not even touch his body, AC to AC to AC and all that. Lack of sleep and all that. So comorbidities, of course, are also a problem. Because when we have multiple chronic conditions, treatment becomes more complex. Lifestyle modification, inertia. Remember that they say a fool at 40 is a fool forever. It's for a reason. It's not an insult. It means that there is a lot of resistance to change when people cross 40. That's what it just means. And of course, limited availability of specialized services, shortage of cardiologists, and a lot of other issues like that. Long-term care and follow-up is another problem. Some people even get tired of the matter and they just say something must kill a man, I beg. And of course, eventually some people are very unfortunate, something kills them. Then you see psychological factors like depression, age and frailty is another problem. You understand? Limited resources or low income in certain countries. You know what is happening in a particular country, I don't want to call the name. Economic challenges terrible. Inflation rate is more than 400 or 500%. And, people are buying private jets and doing all sorts of rubbish. And you can see that these things are having negative impact on the health sector. Then fear and anxiety is another problem. Imagine you tell somebody that you have a heart attack. Some people don't even know what heart attack is. They're already thinking that they're already dead. They're already telling their wife, I have one land beside the river. Mr. Calf was weighing me 200 million. They think they're dying already. Fear and anxiety. And oftentimes that fear and anxiety can increase blood pressure that can eventually still kill them. So it's better to, these are the challenges management of this problem. Chemical intervention. We're not going to dwell too much on this because I'm not discouraging anybody from taking their medication. Now, we've talked about this briefly before. Calcium channel blockers, amlodipine. That's just what I'm going to add here and others. Of course, you see that we have the angiotensin receptor blockers. We talked about that briefly before, and so on and so forth. But let's not forget the side effects of this medication. I often tell my patients, these drugs are poison. It's not food. It's not chin-chin. When you have an appointment, stick to your appointment. If you have a prescription, stick to the prescription. If you have a problem, contact your doctor and explain, because don't take decision on your own. Typical example is someone that is taking statins. The body also needs cholesterol. So if they told you that this drug is for reducing cholesterol, take one tablet at night, or they give you something like simvastatin, they say take 10 milligrams at night. And because you feel that it takes care of cholesterol, you want to take 50 and want to finish that cholesterol. Cholesterol is very important. In fact, about 23% of all the cholesterol in your body is in your brain. So what we don't need is excess. So it's just like we're trying to balance between the toxicity and the therapeutic action of these drugs. All of them are poison. Just know that. So be careful when you use them. And for instance, these thrombolytics, like we just mentioned, can cause bleeding, allergic reaction, headache, and so on and so forth. The same similar thing with antiplatelet agents. The statins cause muscle pain, liver damage, gastrointestinal symptoms, cognitive impairment, increased blood sugar. You can see the AC, angiotensin converting enzyme inhibitors, they cause dry persistent cough as a result of excess bradycardia, bradykinin in the, as a result of excess bradykinin in the blood. And you can see hypotension is another problem, and a lot of other issues. So you can see them. Look at beta blockers causing bradycardia, hypotension, fatigue, dizziness, and all that. Somebody will be taking beta blockers, and when the person goes to somewhere, he doesn't want to say, hey, these people are after me. Nobody's after you. The dizziness that is happening as a result of the beta. So these are things that we need to be. So it's better we don't even get these problems at all. That's what I keep advising patients. Because the question is, imagine that you are 40 years old, or you are 41 or 42 or 43, and you have to live to 100 years, and you want to be taking amlodipine, you want taking losartan, candesartan, you want to take lisinopril, you want to take clopidogrel, dapigatran, you want to drink all these things for the next 60 years, better save yourself. And we'll talk about that shortly. So let's not forget that we're not supposed to adjust our medication without the guidance of a trained health practitioner. Now, what are the importance of natural pharmaceuticals in the management of heart attack and chest pain? Because, of course, we're supposed to bear in mind that these natural pharmaceuticals are one of the best ways to help because they don't have side effects. Yes, it may be expensive because the way they are being produced, that's the real deal. I'm not talking of these ones you just buy all over the place and say, I'm taking omega-3. What are you taking? Whether you are drinking groundnut oil or you are drinking base oil, who knows what you are drinking? When you put other styrofoam in there, cannot even do anything to it, and you expect it to help you dissolve cholesterol far. Now, these natural pharmaceuticals help improve blood flow to the heart muscles, counter inflammation. Remember that the process via which the blood vessels are being blocked that supply the heart has inflammation affecting all stages. So this is very important. They also help to counter the oxidative species of free radicals that help oxidize bad cholesterol and provoke atherosclerosis. Remember, we talked about stress provoking excess production of free radicals and all that. They help to prevent and manage lifestyle diseases that can lead to heart attack and chest pain. Those lifestyle diseases, remember that they move together, all for one, one for all, or one for all for one. And that means that if somebody is having obesity, is the mother of lifestyle diseases. Be expecting type 2 diabetes, hypertension, high blood cholesterol, fatty liver disease, ischemic stroke, heart attack, angina pectoris, DVT. All of them begin to come together if one does not take care. And that's what I call things fall apart. Then you see, it also helps in professional weight management. Professional weight management is not that thing people are doing. They keep undergoing malnutrition. Malnutrition is not the same thing as professional weight management. In fact, if you listen to people that have lumbar spondylosis, you find out that, which is often, and you see that some of them, you see desiccation of the disc. You now go and add malnutrition to it because you're trying to reduce weight. Of course, we know that excess weight can also cause more stress or joint stress in the lumbar region of the spine and can compress the sciatic nerve roots, especially in L4, L5, or L5S1 area, or L3, L4, and cause sciatica and other. And you go and say you want to reduce weight, and you have to undergo malnutrition. Have you forgotten that the intervertebral disc here does not have blood supply? And then you now go and starve, just managing to get things via diffusion, and you now go and starve it via malnutrition because you're trying to lose weight. And then you come back and say, the weight loss did not work. My back is getting worse. So these are the kind of things you need health professionals to guide you so that you will only take out the fat. Since we know that obesity is defined as excessive detrimental accumulation of fat in the body, that is the definition of obesity. So once you remove the fat, you lose weight. That is it. So we'll talk about that shortly. Or you go to Dr. Drugs on YouTube and you watch something on weight management and lifestyle modification and all that. Then we have that they help against depression. Remember I mentioned that some people, when you tell them that they have heart attack, they may never sleep again, because they think that since the person has a attack, the heart can attack them in the night anytime, you see, and that can make them have poor sleep. So this will also help improve sleep, and it also makes them unhappy because they feel that they are dying soon. And these natural pharmaceuticals can help against depression. These are just a few, but let's take an example of some biomolecules. Let's just take this company, Forever Living product. I'm not saying that you must use Forever Living products, but this is what I use for my patients, and I get amazing results. Focus on the active ingredients I'm going to be talking about, but I'm also showing you one of the best sources of these active ingredients. Please, let's take note of that. If you can find your active ingredients anywhere else, fine. But if you're my patient, this is what I'll give to you. Now, it contains eicosapentaenoic acid and docosahexaenoic acid, and we're referring to Actic C. This is a wonderful package because this eicosapentaenoic acid and docosahexaenoic acid are omega-3 fatty acids, and they help against what? Inflammation. Prevent cholesterol and fatty substance aggregation in the blood vessels, resolve cardiovascular complications, resolve other associated lifestyle diseases, and counter high blood cholesterol or hypercholesterolemia. Then we have garlic thyme. I want to talk about lecithin. Lecithin emulsifies fat, and we know that cholesterol is the cousin of fat in short. Let us go, cholesterol is a lipid, is fat in short. So when something emulsifies fat, what do you think will happen? What do you think we should do to those cholesterol aggregates in the blood vessels? What do you think will happen? And that's exactly that's why I give my patient this and I get amazing results. Of course, the garlic and thyme, apart from antioxidants, and they have a lot of other things they do, dead DNA and all that. Remember that the DNA of the cells in the inner part of the blood vessels have to be intact, so our cholesterol will not have anchor points to begin to grow and block that area. Coenzyme Q10 is an amazing molecule because it's actually involved in regeneration and rejuvenation of the heart, remember, the lungs, the liver, and kidneys. It supplies energy by boosting cell mitochondrial activity, and of course, it's indicated in treatment of hypertension, stroke, and a lot of other issues, and helps to directly counter high blood cholesterol. That's why it's very important. It's found in where your health. If you're a man and you are here, please, if your ear is an antenna, pull the antenna wide like that olden days black and white television so that you can listen very well. This product is very, very important because it contains L-arginine. There's some patients that buy metoprolol. You will find that beside that metoprolol, you will find arginine metoprolol, arginine metoprolol combination. Have you ever bothered to ask why they put arginine there? It's because arginine leads to what is called nitric oxide production, which is a natural vasodilator and allows blood to flow better through blood vessels. That is why you find out that when people take things like Viagra and all that, you find out that the whole idea is to improve blood flow. But unfortunately, Viagra and the others, they come with some side effects, which include heart attack. So, but when you have a natural source that can give you this nitric oxide boost that will enable blood flow better to the heart and relieve those dying cells of starvation as a result of poor blood flow. What are we talking about here? So you can see you have that L-arginine packed inside here amongst other things that are needed. And as it's working in the upstream sector, it's also improving blood flow to the downstream sector. And that means the owner of the entanglement facility can make the owner of the entanglement arena to be happy in the other room during entanglement. And that's why I see a lot of men, they don't, in fact, this product is not available. That's the problem. I have a lot of patients that need it, but it is very scarce. Then it also helps to boost muscle growth because some people already have heart attack and stroke as a result of cholesterol aggregation. And remember that when you don't use a muscle for a long time, it begins to wither off. That's what we call disuse atrophy. That's why you see that exercise is super, super, super important so that the muscle does not waste away. But not only is L-arginine important for the aforementioned reasons, it is also an amino acid, which is a building block of muscles, which are proteins in the body. Talk more about this some other time when we're talking about sexual dysfunction and infertility. This product is what I call the use is, in fact, the uses are numerously numerous. So they just summarize. You understand? Of course, aloe vera gel, we've known that aloe vera has been used for thousands of years. You need to Google everything you see here, and you see that it improves heart, brain, and liver function, and immunomodulatory effect against foam cells. Remember, I talked about those white blood cells that try to come and rescue the situation when those cholesterol, bad cholesterol, oxidized bad cholesterol are anchoring to cause problem in the blood vessel. And in the process, they themselves now begin to add to the problem. And then guess what? The smooth muscle cells form a cap over them, and problem goes when the cap gets chipped. Clotting happens, and the blood vessel is blocked. You can see this prevents foam cells formation. Anti-inflammatory, antioxidants that protect the inner vessel cells. Remember, the DNA of those cells are also very crucial. Regeneration and rejuvenation, this is number one somatic stem cell stimulant that I know. You've been hearing about the ones they say they put under the tongue, they don't, all those things are fake. You can never, ever, ever put stem cells under your tongue and it will pass through the barrier of your sublingual area. Those, how can cells pass through cells? Common sense. And secondly, how can you say that you have stem cells that you swallow and then they enter and mix the hydrochloric acid in your stomach that can dissolve iron, and they now survive and pass again down to the intestine and now go into the bloodstream? Come on, all these things don't make sense. I mean, scientists, those things are not true. You can only have somatic stem cell stimulants where we have adaptogens, adaptogenic substances. This is number one. You can go and verify from your Google or anywhere. Of course, they improve insulin function, improve gut health, and so on. And it's also anti-hypercholesterolemic, that acts against high blood cholesterol. This is a powerful antioxidant. I know we know that vitamin C or ascorbic acid is powerful, but when you are looking for another grade, like when I have patients that have benign prostatic hyperplasia and want to stabilize the DNA more, or they're having prostate cancer and all that, or you see people that are having excess, they're having this high tendency of forming leiomyoma, that's what we call fibroid. I give them these things and some other stuff, and they get better because they assist in the process of mitigating this condition. This is just apart from the things, whatever they are taking, because they are natural sources and they help to assist because they contain very powerful antioxidants. Now, since it contains very powerful antioxidants, you can see that it protects heart cells from damage, from stressors, especially those associated with poor blood flow, atherosclerosis. Let's also talk about the one associated with DNA damage as a result of the oxidative effect of reactive oxidative species or free radicals. You can see how important that is. Fiber helps to reduce blood cholesterol and improve gut health and digestion and counter hypercholesterolemia. This is a 9 days weight loss and detox program, professionally adapted for low caloric diet plan, exercise, and autophagy. Yes, that's the one. Autophagy, which is therapeutic fasting. You see, one thing about the human body is that anytime you undergo therapeutic fasting, it begins to consume what it does not want. The problem is that some people cannot fast to save their life. That's why I say some people, they live to eat. They cannot do, in fact, if you tell them you can't eat breakfast for some time, drink water till 12 after exercising, they'll be like, for what? They said breakfast is the most important meal of the day. Breakfast is a scam above 40. Once you are above 40 years, it is not compulsory. If it were compulsory, autophagy will not be a thing. Because autophagy is around 18 hours without eating any food, so that your body can consume unwanted substances like scar tissue that formed in the liver or excess cholesterol deposit in the blood and all that. So if you come and tell me that somebody that stops that ate dinner by 6 in the evening, if you count 18 hours, where will it land? Is it not 12 in the afternoon? So for those people that are marketing cornflakes and marketing noodles and marketing breakfast things, and you tell people that breakfast is the most important meal of the day so that they can kill themselves with high blood cholesterol, please save yourself. It's not compulsory. You can go for light things like carrots, cucumber, cabbage, and all that. So your body will have some rest. You let your body rest and consume unwanted materials via autophagy. And this Clean 9 program helps to stimulate this. Whatever I say, you can go and check and Google. You find out that breakfast is a scam for above 40. Or when you have the high, in fact, 35 to 40, when you have the high tendency of having lifestyle diseases, scrap breakfast as much as possible. Nothing will happen. Then, so I heard somebody saying that if you don't eat breakfast, it has tendency to affect the brain. I'm like, what? This is a new one. We keep hearing different remixes of all those things. Our ancestors, were they eating breakfast? When they wake up in the morning, don't they just go to the farm straight? Carry fire. Then when they after farming till around 11:30, 12, they now do the yam thing in the, and they were living up to 120, 130. Why didn't lack of breakfast kill them? Wisdom. Now, it systematically includes intermittent appropriate fasting that helps detoxify the liver as well. And generally, it helps against other lifestyle diseases, ensures weight loss without rebound weight, and so on and so forth. I've talked about this somewhere in Dr. Drugs on YouTube. You can see when you go to Dr. Drugs, check for lifestyle modification and weight management, and you will see this there. So, in addendum, remember, you are what you consume. And there is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be on the winning side. That's all. Once you allow your body to rest and you move it away from that area, from that side where it is undergoing more damage than repair, and you move to the side where it's having more repair than damage, you will recover. I have an uncle that has had stroke 3 times. He just came back from America alone. He has recovered because he lifestyle modification, introduction of pharmaceuticals, followed all the rules and regulations. He's a medical doctor, followed all the rules and regulations, and after 3 strokes, it's like the strokes are even making him better self. I don't even understand. That tells you that the body can heal itself, but be on the winning side. For those that have spondylosis, that know or that they have heard about what is called 50-50 surgery, don't remember that even that intervertebral disc can heal itself if you allow it. You are weighing 200 kilograms and you are short as 4 feet. You are almost like a ball and you are wondering why your back is aching you. The moment you bring your weight down to the normal range of BMI of 18.5 kilograms to 24.9 kilograms per meter square, 18.5 kilograms per meter square to 24.9 kilograms per meter square, you find out that the intervertebral disc will have some break. And then you find out that if you with proper dieting and adequate natural pharmaceuticals, it will go. As far as there's no other provocative factor that makes the situation complicated. Now, kindly remember that you do not adjust medication and dosage without the guidance of a trained health practitioner. Very, very important. You can see the guy in this picture is not joking at all. That's very, very important. Prevention is better than early detection. Some people are eating, as I'm talking to you right now, somebody is just putting rice on the fire, a whole bag of rice on the fire to eat with one whole cow and all the fried plantain and everything. And the person is maybe listening to this, our lecture now with style, and he's still frying chicken, frying hot dog, frying everything to eat by 10 p.m. tonight. And wake up 6 a.m. and he say, oh, they say breakfast is important, to eat again. My brother Stein, the Lord, prevention is better than early detection. Be on the winning side. On this note, I'll say thank you so much for coming. Good night and God bless. Bye.